Inflammation of the gums, or gingivitis, is a frequent dental problem. In the United States, bleeding gums are a common symptom of gingivitis that affects more than half of the adult population. Gingivitis is the initial stage of periodontal disease. Gingivitis, if left untreated, can cause complications throughout the body, especially cardiovascular disease. Gingivitis can be treated in a number of ways, and a dental hygienist can make recommendations, but there are also a number of tried-and-true home cures. If you're between dental checkups and worry you could be getting gingivitis, you can try these at home. Many of us would prefer to put off going to the dentist if at all possible. Just how quickly can gingivitis be treated? Maintaining regular oral hygiene, avoiding sugary and acidic foods, consuming lots of water, and using efficient home therapy are the quickest ways to recover from gingivitis. By the way, if this channel were a mouth, then the best way to keep it clean would be if you liked this video and subscribed. It would mean a lot to the growth of health worldwide. With that said, let's get this video going. Get rid of gingivitis with one of these 7 tried-and-true home treatments backed by science. Number 1. Oil pulling. Oil pulling is a practice that has probably caught your attention. It's gaining traction, and there's an impressive body of research to back up its claims. Swish some coconut oil around in your mouth and you'll get cleaner teeth and gums. Plaque on teeth and gum irritation can be efficiently combated by gargling with coconut oil. How can you treat gingivitis at home? Home remedies for gingivitis include oil pulling and a saltwater rinse, both of which have nearly no negative effects compared to mouthwashes containing alcohol. How to do oil pulling. Using a spoonful of coconut oil, swish it around your mouth for 5 minutes. Once entering the mouth, it should transform into a liquid. Please don't ingest any of the coconut oil. Coconut oil should be gargled and then discarded. At room temperature, it solidifies, making it suitable for disposal in the trash. Don't gargle it or flush it. It would be a good idea to gargle. Increase the time you swish the oil around from 5 minutes to 15 minutes as you become accustomed to the practice of oil pulling. Oil pulling with coconut milk has some scientific support, but the Ayurveda practice of oil pulling with Remedies has even less. Number 2. Saltwater rinse. In order to treat gingivitis and reduce its symptoms, a saltwater mouth rinse might be used. According to research published in 2016, rinsing with salt water can help heal gingival bleeding and inflammation. Although the latest study included xylitol and lysozyme, it still demonstrates that the use of a sea salt-based mouthwash in regular dental hygiene decreases the bacterial levels that contribute to gingivitis. Gingivitis, may it be cured by yourself? Gingivitis can be treated at home with a combination of oil pulling to remove bacteria and a saltwater rinse to promote healing of the gums. You can speed up the recovery time after gum surgery, including minimally invasive periodontal surgery for gingivitis, by rinsing your mouth with salt water afterward. Evidence supporting the use of salt water to treat gum disease. Making a salt water rinse that actually works. Warm up 8 ounces of water and add 1 teaspoon of salt to it. For 30 seconds, use the salt water to gently rinse your mouth. Hold your water intake. Spit out the salt water after you're done. If your gums are still sensitive after 3 days of using the salt water rinse, see your dentist. Number 3. Lemongrass mouthwash. The essential oil found in lemongrass has been used to treat a variety of ailments, including indigestion and hypertension. Another possible health benefit of using a mouthwash infused with lemongrass oil is that it can help treat and prevent gingivitis more effectively than regular mouthwash. In 2015, researchers found that a mouthwash containing 0.25% lemongrass oil was somewhat more effective than a mouthwash containing 0.2% chlorhexidine at lowering dental plaque and improving gingival health. A more recent study found that using a mouthwash infused with lemongrass oil may help with the treatment of chronic periodontitis and protection of cardiovascular diseases. Gingivitis can also be referred to as periodontitis. Keep in mind that heart disease is a real risk if gingivitis is left untreated. Recipe for an efficient mouthwash with lemongrass oil. Add a few drops of lemongrass essential oil to 8 ounces of water. Warm the mouthwash with a gentle swishing motion and the oil from the lemongrass for around 30 seconds. Spit it out the bathroom sink when you're done. Use a mouthwash containing lemongrass oil 3 times daily until your gums no longer hurt. Number 4. Baking soda. In addition to its culinary and cleaning applications, baking soda has been studied for its potential to alleviate dental issues. An effective dentifrice can be made by mixing baking soda and water to form a paste. Using baking soda-based toothpaste is another way to boost your gum health. How can you reverse gingivitis naturally? Gingivitis can be treated at home with simple measures like a baking soda paste, a mouthwash containing tea tree oil, or a saltwater rinse. Periodontal disease is avoidable if you maintain adequate oral hygiene. Method for creating a powerful baking soda paste. Prepare a mixture of 1 teaspoon of baking soda and 1 cup of warm water. Your desired consistency can be achieved by varying the amount of water used. Gently rub the baking soda paste on your gums for 30 seconds if you made a thicker paste. Rinse your mouth out with some warm salt water when you're done. The baking soda mouth rinse, if you made a liquid version, should be swished about for around 30 seconds. Spit it out and flush it down the toilet after you're done. Repeat as often as 3 times a day until your gums are no longer sensitive. Number 5. Topical turmeric gel. Inhibiting inflammation, turmeric may serve as a preventative measure against gingivitis. Curcumin, one of its main components, has been linked to improved oral health and overall wellness. While much of turmeric's curative curcumin is lost in the digestion process, much of it is preserved when applied to the gums. An assessment of the scientific literature published in 2016 suggested that turmeric could prevent and treat gingivitis. How to create and use a topical turmeric gel. In a bowl, combine 1 teaspoon of turmeric, or curcuma, and a few drops of warm water. Your desired consistency can be achieved by varying the amount of water used. The gums are very sensitive, so be careful when applying the gel. 10 minutes of rest time is recommended for the turmeric gel. Facial muscles are easily strained, thus restrain yourself from doing so. If you want to get every last bit of gel out of your mouth, just swish some warm water about in there. Spit the liquid out. If you accidentally ingest any gel, don't worry, it's harmless. All traces of turmeric in your mouth should now be gone. Do this twice a day until your gums are no longer sensitive. Some people recommend massaging their gums with a mixture of baking soda, turmeric, and salt. Number 6. Aloe vera mouth rinse. Often used to soothe sunburn, aloe vera may also be effective in treating plaque-induced gingivitis. In 2016, researchers found that, when compared to standard chlorhexidine mouthwash, aloe vera was just as effective in reducing plaque and gingivitis. Formulation and application of an aloe vera mouthwash. Combine aloe vera juice, ½ cup, with water, 1 cup. Depending on how dry you want your coffee, you can add less water. For around 30 seconds, use the aloe mouth rinse to gently swish your mouth. Hold your water intake. When you're done, just gargle with the aloe vera water and spit it out. If your gums are sore, you should repeat this process 3 times a day. Number 7. Tea tree oil mouthwash. Tea tree oil, sometimes called melaleuca oil, is an antibacterial essential oil derived from a tree native to the wet climates of the southeastern coast of Australia. Tea tree oil is an essential oil that has gained popularity because of its ability to kill harmful microorganisms, but it must be used with caution because even small amounts can be fatal. Results from a research scheduled for release in 2020 suggest that tea tree oil may be a safe and effective replacement for traditional mouthwashes that contain alcohol. Mouthwash with tea tree oil shows promise as a treatment for gingivitis. There have been no recorded adverse effects from using tea tree oil gel for gingivitis, which has been the subject of numerous research dating back to the 1980s. How to create and apply tea tree oil mouthwash. Add 2 to 3 drops of tea tree oil and 8 ounces of warm water. Swish the mouthwash containing the tea tree oil for about 30 seconds while moving it gently from side to side. If you accidentally take tea tree oil, it could have unpleasant side effects. Then, after you're done, just spit it down the toilet. Use a mouthwash containing lemongrass oil 3 times daily until your gums no longer hurt. Because tea tree oil is poisonous if swallowed, you should check with your doctor before using it in a DIY mouthwash. Healthy habits to prevent gingivitis. Gingivitis, like most diseases, is best avoided by preventative measures. If you do that, you won't need to resort to any alternative treatments. Gingivitis can be treated at home by adhering to following practices. Brush your teeth twice a day, using gentle circles at a 45 degrees angle towards your gums. Floss in between your teeth daily, but without pressing hard on your gums. Use a natural mouthwash, but not an alcohol-based solution that can ruin your oral microbiome. Air dry your toothbrush, with your brush head facing up and situated far from a flushing toilet, so as to avoid bacteria growing in the bristles. Avoid sugary foods, since sugar feeds the bad bacteria in your mouth. Foods that fight gum disease. Here are some foods and drinks that can help you avoid gum disease. Water. Fresh fruits and vegetables. Green and red bell peppers. Sugar-free xylitol gum. Probiotic-rich foods. Green tea, no sugar. Fatty fish. Nuts and seeds. Dairy, like milk and cheese. Common symptoms of gingivitis. Here are the common symptoms of gingivitis, aka periodontal disease or early periodontitis. Swollen gums. Dark red gums. Receding gums. Sore gums. Gums that bleed easily. Halitosis, bad breath. Can gum damage be reversed? Yes, damage to the gums can be fixed. You have to be gentle with your gums but intentional with your oral health. There are natural home remedies for gingivitis that have few or no side effects, like oil pulling, mouthwashes with essential oils, and a saltwater rinse for healing wounds. If you need more advice or treatment concerning your gingivitis and periodontal disease, schedule an appointment with us today for a biological dentist's approach. There you have it. Will you be changing the way you take care of your oral health? Leave your answer in the comment section below. If this video was helpful, please like and subscribe so that health can go viral. I hope you enjoy this content. Stay tuned for more videos on how to improve your health. For a list of powerful home remedies, click on the links below. Eat well and prosper.